Knock knock, Mr. Malloy.
Hello.
Hi there, my name is Brooke. I'm going to be your provider today. It appears that today you're here for a comprehensive physical assessment. Throughout this assessment, I am going to be hands-on, putting my hands on your head, on your chest, your back, and feeling some of your pulses throughout your body. Is that okay with you?
Yes.
Okay. We're going to start by confirming your full name and date of birth. Can you tell me what that is?
969 is stuff one.
Thank you very much. I'm going to ask you a few silly questions to start. Could you tell me what year it is?
It's 2023.
What is it?
2023.
Okay. And who's our president?
Joe Biden.
And where are we right now?
In the clinic.
Okay. So our patient does appear to be alert and oriented ×3. Speech is clear and appropriate. To start, I'm going to inspect your head. Just off of inspection, your head does appear to be symmetric. No masses or lesions are noted. I'm going to go ahead and feel around on your head to see if I feel any inconsistencies. Okay. All right. No lice is noted. The patient's head is in fact midline and symmetrical. Still no lesions or lumps are noted. I'm now going to palpate your lymph nodes. I'm going to feel a little bit here on the front of your ear, in the back, the pre and post auricular, along with some other lymph nodes throughout your neck and throughout your chest. You let me know if you feel any pain, and I'm going to feel for any swelling. Any pain there? Okay. I'm going to move down your neck here. Any pain? Okay. I feel under your chin. Okay. And down the rest of your lymph nodes. Wonderful. Okay. Your lymph nodes do appear to be bilaterally symmetrical and intact. No edema is noted and no pain is reported by the patient. I'm now going to move on to our cranial nerves. To start, we're going to start with cranial nerve number 1, the olfactory nerve. I'm going to have you go ahead and smell this and tell me what you smell.
Peppermint.
Okay, wonderful. And I'm going to have you plug one of your nostrils and breathe in and switch. Very good. I'm going to take a look with my pen light inside your nose. Thank you very much. All right, the mucous membranes do appear to be pink, moist, and intact, and there is no septal deviation that is noted. Cranial nerve number 1 is intact. We're now going to move on to cranial nerve number 2, which is going to be the optic nerve. I'm going to have you go ahead and read the Snellen chart straight ahead in front of you. I'm going to have you read with one eye at a time and then both eyes. So do me a favor, cover up your right eye, read the lowest list of letters.
DGTV.
Okay, and switch for me.
DGTV.
Very good. And then with both eyes.
DGTV.
Very good. Patient's vision does appear to be intact. The patient does appear to have 20/20 vision. We're now going to move on to cranial nerves number 3, 4, and 6, which are your oculomotor, your trochlear, and your abducens cranial nerves. What I'm going to do is I'm going to have you follow my finger. I'm going to move it in a star-like pattern. I'm going to be looking for any extraocular movements or nystagmus, which is the shaking of your eyes, okay? So follow my finger. With just your eyes. Try not to move your head, just your eyes. Okay. No nystagmus is noted. No extraocular movements are noted as well. Eye movement is equal and symmetric bilaterally. We're now going to move on to cranial nerve number 5, which is your trigeminal nerve. I'm going to go ahead and put my fingers here in your jaw and under your chin. I'm going to ask you to open your mouth frequently. I'm going to be assessing for TMJ, and I'm also going to be assessing for your jaw strength. Open your mouth and close, and again, and close. Okay, I'm going to put my thumbs under your jaw. Now open your mouth, push against my fingers. Very good. Jaw strength the patient has great jaw strength. No crepitus is noted. No TMJ is noted. I'm now going to go ahead and move on to cranial nerve number 7, which is the facial nerve. So do me a favor, smile and frown. Stick your tongue out and puff your cheeks out. Okay, the facial nerve does appear to be intact. All facial movements are symmetric and bilateral. We're now going to move on to the acoustic nerve, which is cranial nerve number 8. I'm going to go ahead and whisper 3 words in each of your ear, and I'm going to have you report back to me what I said, okay?
Big yellow bone. Purple dinosaurs running.
Very good. Cranial nerve number 8, the acoustic nerve, does appear to be intact. Cranial nerve number 9, now we're going to move on to the glossopharyngeal, and also cranial nerve number 10, which is your vagus nerve. I'm going to have you stick your tongue out and say ah. I'm going to look at my pen light. Say ah. Okay. And I'm now going to take my tongue depressor, stick your tongue out again. Okay. The patient's gag reflex does appear to be intact, therefore cranial nerve number 9, the glossopharyngeal nerve, is intact. And in terms of cranial nerve number 10, the vagus nerve, the uvula does rise and fall with phonation, therefore cranial nerve number 10 is intact. We're now going to move on to cranial nerve number 11, which is your spinal accessory nerve. I'm going to put my hands on your shoulder, and I'll have you push against my hands, assessing your shoulder strength, and just kind of shrug, okay? Go ahead and shrug for me, up to your ears. Very good. And down. Any pain? Okay. Cranial nerve number 11 does appear to be intact. I'm now going to have you stick your tongue out for me, straight in the middle, and to the left, to the right. Okay. Cranial nerve number 12, the hypoglossal nerve, does appear to be intact. The tongue is midline, no deviations, and movement is symmetrical and equal bilaterally. Excuse me. I'm now going to assess your ears. I'm going to be pushing on your tragus, your pinna, and your auricle. You let me know if you feel any pain, okay? Any pain? Okay. Pushing on the tragus, no pain? Okay. I'm going to take my otoscope and look inside the ears to assess for any excess rumen, drainage, or swelling or erythema. None noted in the left ear, and none noted in the right. The membrane does appear to be pearly and gray. I'm now going to move on to your sinuses. I'm going to push on your frontal and your maxillary sinuses. You let me know if you're feeling any pain, and I'm going to assess for swelling. Any pain? No? Here? Okay. The sinuses do appear to be equal and symmetrical bilaterally. No edema or pain is noted. I'm now going to move on to the mouth and the throat. So open up your mouth for me. Pull your bottom lip down and your top lip, and lift your tongue up for me. Very good. No lesions or masses are noted. No excess drainage or abnormal color of drainage noted in the mouth. The mucous membranes do appear to be pink, moist, and intact. I'm now going to move on to the trachea and assessing your thyroid. I'm going to put my hand right here on your trachea. I'm going to ask you to swallow, and then I would stand behind the patient, but because I'm limited with space, I would be feeling for the thyroid. So I'll go ahead and start with that. Identify the notch. Okay. The thyroid does appear to be symmetrical and bilaterally intact. No swelling is noted. I'm now going to put my hand on your trachea. If you could swallow for me. Okay. Swallowing is normal, and the trachea does appear to be midline. No deviations are noted. Now I'm going to have you complete some range of motion. So I'm going to have you flex your neck down and extend it back. Very good. To the left, to the right. All right. Any pain upon moving your neck? Okay. All range of motion. The patient does appear to have full range of motion of the neck. I'm now going to have you, while we're on range of motion, I'm going to have you show me some range of motion of your upper and lower extremities. So if you can, move your arms forward and down. You move them back. Very good. And forward and down. Now I'm going to have you abduct your arm, move it out, and back towards your core. Same on the other side. Very good. Any pain in the shoulders or the joints? Patient does appear to have full range of motion of the upper extremities. I'm going to have you take a look at your hands now. Your joints do appear to be bilaterally symmetric and intact. No edema, no erythema is noted. I'm going to have you go ahead and take your wrist and bend them forward, straight. And then I'm going to have you move them in a supine position. Very good. Any pain there? And over. Supine again. Very good. And flat down. Flip. Very good. Full range of motion of the hands and wrists bilaterally is noted. I'm going to have you stand for me. And I'm going to have you walk 5 feet that way. and back this way. The patient's gait does appear to be stable and normal. Go ahead and take a seat. Do me a favor, flex your feet up and down and out to the outwards. We call that eversion, and then inversion in. Very good. I'm going to have you do the same thing with your hands. Eversion out and then in. Very good. Okay, the patient does appear to have full range of motion of the lower extremities as well. I'm now going to move on to listening to your heart and lungs. Give me just one moment. So sorry about that. One of my nurses needed me briefly. I'm going to first listen to your heart. I'm going to listen to the aortic valve, the second intercostal space, right sternal border. Okay, now I'm going to listen to your pulmonic valve, your second intercostal space, left sternal border. Now I'm going to listen to Erb's point, which is your third intercostal space, left sternal border. And I'm going to listen to your tricuspid valve, which is your fourth intercostal space, left sternal border. And your mitral valve, which is your fifth intercostal space, left sternal border. Okay. I'm now going to listen to your apical pulse for a full 60 seconds. 60 seconds has passed. The patient's heart rate is 74 and the rhythm is in fact regular. I'm now going to go ahead and listen to your lung sounds. Again, the chest does appear to be symmetrical, skin is intact, no wounds or skin abnormalities are present. I'm going to take a listen to your lungs, take a deep breath on the front and also on the back, okay? So take a deep breath for me. Okay, good. Lung sounds do appear to be bilaterally clear. I'm going to take a listen to your back now. Lungs are also sounding clear and intact bilaterally. I'm going to assess for tactile fremitus, so I'm going to put the base of my palms on your chest and also on your back, and I'll have you say 99 every time I move my hands, okay?
Right.
Go ahead.
99, 99, 99, 99.
Okay, if you could sit up a little bit for me. Okay. No tactile fremitus is noted. Okay. I am now going to have you lie back. I'm going to assess your abdomen. You want me to help you with that?
I'm okay.
Got it? Okay. First, I'm going to inspect the abdomen. Okay. The abdomen does appear to be symmetrical. No skin abnormalities. Your skin does in fact appear to be intact. Can I have you come a little bit closer to the edge of the bed? I'm sorry. Thank you. Very okay. So upon inspection, the patient's abdomen is symmetric and skin is intact. I'm now going to auscultate. I'm going to listen for your belly sounds, okay? Just breathe normal. Starting in the right lower quadrant. Okay, your bowel sounds are normoactive in all four quadrants. I'm now going to percuss. I'm going to take my third finger and I'm going to be striking with my other finger on your abdomen to be listening for dull or tympanic sounds depending on where I'm tapping in the belly.
Okay.
Any pain? Okay. No? Okay. All sounds are normal with percussion. No abnormalities are noted. I'm now going to palpate, or I'm going to push on your abdomen lightly and then a little bit deeper to feel certain organs and certain borders to assess if they are enlarged or not. Let me know if you feel any pain. Any pain here? Here? Yeah? Okay. Or here? Okay. Upon light palpation, no tenderness is noted, no masses are felt at all. I'm now going to assess for a Bloomberg sign. So I'm going to be pushing a little bit harder in your right lower quadrant, assessing for any potential of appendicitis. So you let me know if you're feeling pain when I release my hands on your stomach, okay? Any pain? Okay. This patient does in fact have a negative Bloomberg's assessment. No rebound tenderness is noted. I'm now going to feel for the border of the liver. So take a nice deep breath for me. Any pain? No? You sure? Okay. No pain noted. I'm now going to assess for the spleen as well. Any pain? Okay.
No.
The spleen and liver both appear to be within normal sizes. The border of the liver is noted, is palpated. I'm now going to assess no, you can lay back. Oh, you're going to scoot back? Whichever works. I'm going to feel for the pulses in your body. I'm going to start from head to toe, so you're carotid, assessing one pulse at a time. Carotid pulse is equal and bilateral +2. I'm going to take a listen as well for any carotid bruits that may be here in your carotid. This can indicate arthrosclerosis, some plaque buildup. So we're going to go ahead and take a listen to that. And since you are in fact at a 45-degree angle, I am able to see there is no jugular venous distension present at this time. So I'm going to listen to one carotid artery at a time. So do me a favor, turn your head to your right. I'll listen to your left. Okay, take a nice deep breath and hold it. Okay, you can release. Very good. Turn your head for me the other way. I'm going to take a listen. I'll let you know when I need to have you hold your breath. Okay, hold your breath for me. Okay, and release. No carotid bruits are noted at this time. Go ahead and put your arms down to your side for me. I'm going to palpate for your brachial pulse. Pulses +2 equal and bilateral. I'm now going to assess for the radial pulse. +2 equal bilateral. The femoral pulse. +2 equal bilateral. Your popliteal, which will be behind your knee here. You can rest your legs. +2 equal bilateral, and as I am assessing the lower extremities, I do see that the skin color is within normal range for the ethnicity. The skin is intact, no wounds, lesions, drainage is noted. I'm now going to assess for the posterior tibial and the dorsalis pedis pulses. Relax your foot for me. All right. Capillary refill is less than 3 seconds. And last but not least, I'm going to palpate for your abdominal aorta, right here in the middle. All right, the pulsations are noted. Any pain here? Okay. Normal assessment for the abdominal aorta. Do you want me to help you sit up at all? You're okay, you got it? All right, Mr. Malloy, thank you so much for letting me partake in your care today. Is there anything I can get for you at the moment?
I'm okay.
Okay. I'm going to go document my findings, and I'll be back for you shortly. Essentially, the patient's assessment, he does have a negative assessment, and I would perform hand hygiene and document my findings.